Cancer or its treatment can decrease the way that your immune system works. So it's harder for your body to fight off infection. What we want to do is we want to decrease your risk of foodborne illnesses. And the way that we do that is by practicing certain food safety guidelines. One thing that you want to make sure to do is to wash your hands often. If you're not usually around somewhere where you can wash your hands, such as a bathroom or a sink, if you want to carry some antibacterial gel around with you and just use it throughout the day. Another important thing is to try and avoid sick contacts. So if you have anybody in your household that's sick, trying to make sure that you're washing your hands around them, maybe wearing a mask, avoiding large crowds if possible, just trying to keep yourself safe. So during your treatment and sometimes thereafter, if your white blood cell counts are low and you're still at risk of infection, making sure to wash your fruits and vegetables really well. You never want to take something from the grocery store and immediately eat it without washing it. A large misconception is that someone going through cancer treatment can't have any fruits or vegetables, and that's absolutely not true. Just make sure that you're washing them to get rid of any bacteria or dirt or anything that might be on the outside of it. You should be okay. Another important thing is to avoid any raw, undercooked seafood, poultry, fish, eggs, anything like that that could have some live bacteria. You really want to make sure everything is cooked well through. If you are having a steak, try and cook it like medium well. Avoid anything that's rare, raw. Another common question that I get is, can you have brie cheese? It's very important throughout your treatment, if your white blood cell count might be low, to avoid any unpasteurized milk products, milk or dairy products, such as brie cheese, camembert, any kind of blue cheese dressing, things like that. Another common question is raw oysters or shellfish, sushi, things like that. Anything that's uncooked that might have risk of foodborne illness, you definitely want to avoid. Two more important things: make sure that you're using different cutting boards for your meats and your fish, separate from your vegetables or your fruits. Sometimes the easy way to do that is color coding your cutting boards. So you could use red for meat and green for vegetables. Another important thing is to try and drink bottled water. You're not always sure where your water source is coming from, if it could have bacteria or things like that. So the safest way is just to drink bottled water. So if you or a loved one need to go somewhere for cancer treatment, we hope that you choose the Simon Cancer Center. And if you are here in the neighborhood and you have questions and would like to speak with me, just ask for Alexis. I'm the registered dietitian here on staff.